As previously discussed, the main body of CPT Category 1 is listed in 6 sections: evaluation management, anesthesiology, surgery, radiology, path lab, and medical. The surgery section of CPT is the largest of the 6 sections and includes procedures performed by physicians of any specialty type, such as general surgeons, ophthalmologists, cardiovascular surgeons, neurosurgeons, and so on. It is important to recognize that the listing of a service or procedure and its code number of a specific section of CPT does not restrict its use to a specific specialty group. Any procedure or service in any section may be used to designate the services rendered by any qualified provider and professional. Within the surgery section, it is further divided into subsections based on each of the medical systems involved, such as digestive system, cardiovascular system, and so on. Within these individual subsections are the procedure or services performed. Do not select a CPT code that merely approximates the service provided. Research is needed to make sure the most accurate code has been located. Selections must be reviewed against surgery guidelines. These are located in the beginning of the surgery section and also throughout the subsections, definitions, and further guidelines pertinent to the specific subsection or procedures and services performed. By their very nature, the services to any patient are variable. The CPT codes that represent a readily identifiable surgical procedure thereby includes, on a procedure-by-procedure basis, a variety of services. In defining the specific services included in a given CPT surgical code, the following services are always included in addition to the operation per se: local infiltration, metacarpal, metatarsal, digital block, or topical anesthesia. Subsequent to the decision for surgery, one related evaluation management encounter on the date immediately prior to or on the date of the procedure, including the history and physical. Also, immediate post-operative care, including dictating the operative notes, talking with the family and other physicians or other qualified health professionals, writing the orders, evaluation of the patient in the post-anesthesia recovery area, and typical post-operative follow-up care. Your CPT workbook offers several examples of surgical package, and please review these. Medicare definition of a surgical package depends on if the surgery is considered major or minor surgery. This information is located in the Medicare Provider Manual located on the CMS website at cms.gov. For example, a major operation may carry a large number of days in which follow-up care would be included in a certain amount of time, such as 30 or 90 days. These are called global periods. Conversely, a small service, such as a laceration repair, may carry 0 to 10 days. The Medicare global surgery definition for major surgery includes the surgery, preoperative service provided 1 day prior to surgery or the day of surgery, except when modifier 57 or 25 applies. Also, follow-up visits during the post-operative period that are related to the recovery from the surgery, complications following surgery, post-surgical pain management provided by the surgeon, insignificant surgical procedures not performed in the operating room, including dressing changes, removal of tubes, drains, and the like. The Medicare surgery definition for minor surgeries include the actual surgical procedure, prep services 1 day prior of the day of surgery, except when modifier 57 or 25 apply, and post-op services provided within 10 days of the surgical procedure, except when modifier 24 applies. I urge you to please review the modifier definitions in Appendix A for these modifiers. Separate procedure. Surgery guidelines in a CPT book state the following regarding separate procedures. Some procedures or services listed in the CPT code books that are commonly carried out as an integral component of a total service or procedure They have been identified by the inclusion of the term separate procedure. The codes designated as separate procedure should not be reported in addition to the code for the total procedure or service of which it is considered an integral component. However, when a procedure or service that is designated as separate procedure is carried out independently, or considered to be unrelated or distinct from the other procedure or service provided at the time, it may be reported by itself, or in addition to other procedures or services by appending the modifier 59 to the specific separate procedure code to indicate that the procedure is not considered to be a component of another procedure, but it is a distinct independent procedure. This may represent a different session, different procedure or surgery, different site or organ system, separate incision or excision, separate lesion or separate injury or area of injury or inextensive injuries. As you code, you will note that separate procedure appears in parentheses after the code description. Again, modifiers provide more information to the third-party payers. Some payers limit the use of modifiers and offer guidance in the use of modifiers. NCCI National Coding Initiatives. This applies to physician offices and hospitals. A list of coding edits have been developed by CMS in an effort to promote correct coding nationwide. The lists supply codes that should not be used together, such as diagnosis and surgical endoscopy should not be assigned together. This list updates quarterly. There are two types of coding edits: the comprehensive component edit and the mutually exclusive edit. Please review examples of an NCCI listing and edit as located in the cms.gov website.